Anyway, so what is this?
It looks like fluid-filled area.
Mass.
These are all ovarian cysts, right? But I mean, well, they're all adnexal masses, I should say. This is what? How would you describe this?
Hypoechoic.
This is hypoechoic.
Right.
Anechoic, I should say. This is ground glassy, right?
Okay.
Endometrioma. This is classic endometrioma. This is actually what it looks like, and this is actually what they'll test you on. You have a ground glass appearance, and that's actually what it looks like. If you see this, endometrioma for sure. Okay. What about this one down here on the bottom left?
It's got to be a cyst then.
Just a regular cyst.
Yeah, simple cyst. Simple cyst. See how it's just black hole. Simple cyst. And then even in the talk that I had about benign breast disorders, you know, a simple breast cyst will look exactly the same. This could be a breast cyst. This could be an ovarian cyst. It's an ovarian cyst. But what about in this upper right?
Polycyst. It looks like a bunch of cysts.
Bunch of cysts. But what about like this stringy sort of stuff?
Like septations?
They are septations, right? But if you can appreciate this is what hemorrhagic cysts look like. Hemorrhagic ovarian cysts, because they bleed and they scar, they bleed. These are clots really in here. It's not really discrete cysts. Cysts that are cancerous don't really look like this. What they'll do is they'll have a septation like that. If they have like a papillary projection that looks kind of like this, it'll be called a papillary excrescence. That's really bad. That's a really bad sign for carcinoma, for cancers. A benign ovarian cyst that has a half septation like this. Do you know what that is? It'll look like this, but it'll have just like a half septation like that. That's a cystadenoma. It's benign. A cystadenoma will have just like a half adhesion. I mean, a half septation like that. And that's it. That's benign. It's a cystadenoma. What's this? This is our uterus, right?
Is that like an ectopic?
It is. That's what an ectopic looks like. It's an ectopic pregnancy. It's an adnexal mass. Positive HCG, but it's an ectopic pregnancy. Okay. This is a papillary excrescence here. Bad news. If you see this, you're worried. These are septations, okay? And this is actually free fluid in the pelvis. This is concerning for malignancy, okay? If you have a septation that's vascular, so this is using Doppler flow. If your septation is vascular, that's a bad sign. If you have a thick septation like this, bad sign. These are all signs that are concerning, okay? But this is the worst one on the left. That's your papillary excrescence. And see how it looks kind of like that jagged thing that I tried to draw? It looks like this. Bad news. And see, this is kind of, the contents are a little hazy. It's either blood or malignant cells in there. No good. If you can appreciate, see these septations, they're bright, they're strong. These are not. And it's right. That's why you know it's a hemorrhagic cyst. And these are all true in terms of not just exam worthy. This is what you see. So that's what's really good about it. Simple findings regarding for malignancy, I just mentioned. If they're greater than 10 centimeters, that's bad. The papillary components are bad. Anything irregular is bad. If you have ascites, You can have a benign syndrome where you have ascites. You know what that's called? Meg syndrome.
Yeah.
That's where you have a solid ovarian mass, which is a fibroma usually in this fibroma,
And then,
which is pretty much like a fibroid on the ovary. You have a pleural effusion, so the lung, and you have ascites. But generally, if you have ascites, you're thinking of cancer, okay? But you can have something called Meg syndrome. If they mention that there's an ovarian a solid ovarian mass, which is going to be a fibroma, if they ask you for the pathology, and you have a pleural effusion and you have ascites, that's really the deal with adnexal masses. If they're benign, they're going to have thin, smooth walls. They're not going to have solid components or septations apart from what I showed you for the hemorrhagic cyst, and they're not going to have blood flow, okay? The rest of this is pretty straightforward. So remember the discussion I had here that I had mentioned. This is actually pretty high yield. Just to go through it quickly, your dysgerminoma, LDH, endodermal sinus, which is yolk sac tumor, AFP, choriocarcinoma, if you have a molar pregnancy, say, beta ACG, but there's no mass with the choriocarcinoma, just by the way. It goes through the blood, you're not going to see a mass. There's no adnexal mass. I know they have it in germ cell tumors, but there's no adnexal mass with the choriocarcinoma. The closest thing to a mass will be maybe if you had a molar pregnancy or if you had a placental site tumor or something. But placental site tumors are extremely rare. And then your immature teratoma, you'll have some sort of mass, but it'll have everything because it's immature. And embryonal carcinoma is not really a thing that's you're going to see or be tested on. This up here is just talking about biomarkers that are used. These can be used. You'll never really see them used. Your CA-125 is used in your premenopausal patient. They don't even give a value anymore. They used to say 200, but now they're just like, if it's use your judgment, it has to be pretty high. Postmenopausal, it's still greater than 35. And then, you kind of get into, we mentioned with the dermoid cysts, dysgerminoma, granulosa cell. Granulosa cell, it's most common. It makes estrogen. So you have vaginal bleeding is common. Your chylexner bodies, yolk sac tumors, AFP, Schiller-Duvall bodies, and it looks like a blood vessel. I know that was on my Creogs one year. So totally loaded cell, we kind of hit this already. Big cyst, androgens. That's very specific. And then I misspoke. I said in the other lecture, remember polycystic ovaries, ovarian dysfunction, virilization. Either clinically you'll see hirsutism, deepening of the voice, or you'll have elevated testosterone. 2 out of the 3. That's PCOS. And yeah, I'll send out that slide deck, but that's actually really good. It's high yield.